My name is Dr. Marguerite Duane. I'm a board-certified family physician, co-founder and executive director of Facts, the Fertility Appreciation Collaborative to teach the science. As a physician, I commonly get the question from my patients whether or not they should combine different methods of fertility awareness and/or adding condoms to improve the effectiveness of family planning for preventing pregnancy. What is important to note is there are different methods, such as the symptothermal method, that has been studied when women combine cervical mucus secretions and basal body temperature to prevent pregnancy. Some methods, such as the Billings ovulation method, simply use the cervical mucus sign. Whether a woman chooses to use one sign, two signs, or more, the effectiveness rate really depends on whether or not they are following the rules for the specific method. I strongly discourage my patients from trying to combine different methods on their own. Rather, if they want to observe more than one sign, I encourage them to learn a method that teaches the observation of multiple signs. Another question I often get, well, can we use condoms during the fertile window, and will that improve the effectiveness of the fertility awareness-based method? It's important to note that when women use a fertility awareness-based method in combination with condoms or other barriers, this is best referred to as a fertility awareness combined approach. Why? Well, when you're using a fertility awareness method and you identify when you are fertile, if you choose to use a condom at that time, you are relying on the effectiveness of the condom or the barrier method, because based on the FABM, you know you are fertile. Some methods strongly discourage the use of barrier methods such as condoms because it may actually interfere with the observations, such as the cervical fluid secretions. Other methods, such as the symptothermal method, have actually done studies looking at the effectiveness of using condoms during the fertile window versus having couples abstain from intercourse during the fertile window. In that one study, they did not find a significant difference in effectiveness rates between condom usage versus abstinence. But what's important to note, and what I remind my patients of, is when you're using a condom during the fertile window, you can expect the effectiveness rate of the condom. And based on the best research to date, the typical use rate of the effectiveness of condoms is as low as 80 to 82% with typical use. This is much lower than the effectiveness of some of the modern FABMs, such as the symptothermal method, which is 98% effective, and even the Billings ovulation method, which can be 90% effective. Therefore, I strongly encourage women and men to simply inform themselves of their different options and be aware that when you combine a fertility awareness-based method with a barrier during the fertile window, you can expect the effectiveness rates of that barrier method. Again, to use any fertility awareness-based method effectively, we do encourage you to learn from trained instructors and follow the rules of that method and not combine methods. If you find one method doesn't work for you after a few months, then certainly explore other options and consider switching methods to find the method that works best and is most effective for you when it comes to your family planning goals.